Good afternoon, everybody, and welcome into a new episode of Capitol View, a webcast brought to you by the Daily Journal and djournal.com. Coming to you every Monday about 2 o'clock right here at djournal.com. And if you miss any of it, just want to watch it again, catch the replay. It'll be here all day long and into the future. I'm your host, Brad Locke, along with Bobby Harrison, our Capitol Bureau Chief down there in Jackson. Bobby, how are you on this?
All right, Brad. How you doing?
Can't complain, sir. Can't complain. We got these working groups that have started meeting last week. We've talked about it some on the Memo podcast, and want to talk about it here. Had their first round of meetings. Of course, they're looking to try to figure out how to streamline the tax structure and spending in Mississippi, basically. And you had a couple of stories dealing with the Medicaid question, Bobby. Just want to touch on that first. Yeah, I had a story yesterday, and also one today in the Daily Journal and at djournal.com. Start with Sunday's story, Bobby. Talked about the Medicaid growth and trying to curb it, and with the health of the state the way it is, I mean, the literal fiscal health of the people of the state, not an easy task, is it?
No, Medicaid's been I've been down here since '95, and Medicaid spending has been an issue every year since I've been here, Brad, and it doesn't seem like it's going to go away. The working groups, just quick refresher, were set up to, as you said, legislators look for ways to streamline state spending and look maybe to revamp the state's tax structure. But when it gets to Medicaid spending, they were looking for ways to cut spending. But the issue with Medicaid is, if you fit certain income categories, you're eligible for Medicaid, and those categories are disabled, the disabled, certain segments of the elderly population, poor pregnant women, and poor children. And it's just what Medicaid does is pays the health care cost for those people on the rolls, and it's just it's hard to find ways to trim spending unless you just get a healthier population and improve the economy so there's fewer people on Medicaid.
Yeah, and Tate Reeves, the lieutenant governor, and House Speaker Philip Gunn, they had a graph they presented that showed that state support for state support funding for the division of Medicaid had increased by 61% since 2012, from about $588 million to $948 million. But some people say that number's a little bit misleading, Bobby. Why so?
Yeah, Medicaid spend. That number is misleading me, and I won't get into the details why. It's kind of, but essentially, I think the spending for 2012, if you just go back and look at the entire year, was I don't have the number in front of me. You do, Brad. Was about $750 million or thereabouts. Now,
763, yeah.
763, 174 million more than they originally said. So the percentage of growth has not been as high as they said it was in the graph, but that doesn't mean it's not growing. That doesn't mean it's not one of the fastest growing areas of the state budget. And as far as reducing costs, Medicaid Executive Director David Jellett, he has got the legislative approval in recent years to put more to Medicaid recipients under the managed care program, where companies take these recipients and agree to take care of their health care costs for a set amount of money. So on some they may lose money, some they may gain money, and that's the area where they're hoping over a long period of time they do reduce costs some by using managed care, where not only do they provide the health care costs for these people, but they also try to work on preventive care to work on blood pressure, things that call diabetes, so many of the things that are costing Mississippi healthcare, causing so much money in healthcare in the state of Mississippi. They're going to be working on those things, and he hopes over a long period that does help reduce the costs.
And then in today's journal, Bobby had a story about Medicaid expansion and how not expanding as allowed under the Affordable Care Act may actually be increasing costs according to some.
Yeah, that was an interesting story, and in the sense that, quick refresher course again, the Affordable Care Act, Obamacare, as some know it by, allowed states to expand Medicaid to cover the working poor. These are people who are not covered by the regular Medicaid program. As David Jellett pointed out to the working group, a lot of people think that a lot more segments of the population are on Medicaid than they actually are. If you're an able-bodied adult, poor, not making much money, you can't qualify for Medicaid. You got to be one of those groups I talked about a while ago.
Right.
But the Affordable Care Act allows expansion for those who may be working at convenience stores, fast food restaurants, and those types of jobs. And Mississippi has opted not to expand Medicaid because the political leadership says the state can't afford it. But it was interesting in the states that expanded Medicaid during at least in 2015. They spent less in state money on Medicaid than the states that did not expand Medicaid by. I mean, it wasn't even close. It was by a big amount, Brad. I think it was like 70% to 6% or something like that.
Yeah, it was according to this study by the Henry Kaiser Family Foundation. The states that did expand, their spending grew by 3.4%. Those who didn't expand, like Mississippi, grew by 6.9%. So yeah, that's pretty much double.
Yeah. I misstated that, but it's still a lot. And now this is important to point out that during 2015 and 2016, the federal government was paying all the costs for the Medicaid expansion, folks, all the costs of health care. Right. Now that's going to stair step down. Yes. Starting in 2017, they're going to pay 95%, and it would go down to 90% eventually. But it still is. A lot of people would contend that still is a pretty good deal for the state. In the regular Medicaid program, Mississippi pays about a quarter for every dollar spent in health care, and the federal government pays the other 75 cents. And that's the best match rate in the country. Now, in the Medicaid expansion, all the states get the same deal, but Mississippi gets a better deal in the regular Medicaid program because our population is so poor, and so we get the best deal in the nation on the regular Medicaid program.
Yeah, and Representative Steve Holland.
Paying for it.
Yeah, Representative Steve Holland, I was going to say that Steve Holland says that we've lost about $1 billion in federal funds by not expanding. I don't know if he just plucked that number out of the air, but
no, there's been studies that over the first couple of years, the estimate is that about 300,000 people would be eligible and sign up for Medicaid if they expanded, and the money that would be drawn down from the federal government over that period would be about $1 billion. Wow. Which, you know, some people contend that that would help not only with health care in the state, but also help the economic activity in the state. But others contend that the state just can't afford to do it.
All right. Well, let's move on to another topic covered by the working groups last week, and that was the Department of Health and the Department of Mental Health. Lieutenant Governor Tate Reeves had some questions for those departments in regards to cuts they were making. He didn't think those cuts were necessary. They obviously think those cuts are necessary, Bobby. So I don't know if they're going to be able to come to an agreement on that. But you had budget cuts made this past year, and that's why they're saying they need to make these cuts or make these layoffs, cut programs. Reeves said it's not as bad as they were making it out to be.
Yeah, that was the working groups is supposed to have been described as a deep dive into the state into the appropriations of each of the major agencies. Yeah. But the first round of hearings dealt a lot with just the budget for the current year and whether the cuts that the agencies received were as bad as some of the agencies contended they were. And of course, this was all brought about because of changes in the way that money is divvied out to the agencies. In the past, a lot of the agencies got money through special fees to pay for special programs. And a lot of those special fees were eliminated, and so they don't get that money anymore. And so and then also they were having to pay, the agencies were having to pay to receive services from other state agencies. It was just a big change and the bottom line is a lot of people, nobody is sure exactly how it's going to affect the state budget, even though it did that. Matter of fact, an example of that is, here it is, August 29th, and the revenue report for July has not been released yet, or had just been released just right before we went on the air here, or air is the right thing to reference, because they're still trying to figure out how all these changes in special funds and where they're going, how that's going to affect the budget. So a lot of time was spent dealing with that. Governor Reeves criticized the Department of Mental Health. He said they were spending too much on pay raises. The Department of Mental Health folks explained that from their point of view, they were paying, their direct care workers, who were like 3,000 or 4,000 people, or make $16,000 a year when they hire them, and after a certain period of training, they go up to $17,000 a year, which still isn't much. The big pay raises that Governor Reeves referred to, they said were for doctors and psychiatrists and psychologists who they were having a hard time competing with the private sector to keep on state payrolls, and it was just kind of just sort of back and forth. A lot of the hearings were back and forth between Governor Reeves and the agency heads about whether they were cutting more than needed to be cut.
Well, good coverage there from you, Bobby, all last week into this week on these working groups. Of course, they'll meet again next month and see what happens there. That's it for today's episode of Capitol View. Thank you all for tuning in. Coming at you again every Monday about 2 p.m. If you miss it, just go back and catch the replay at djournal.com. Be sure to give Bobby a follow on Twitter at BobbyHarrison9. You can follow me on Twitter at Bradlock. And that is it for this week. We'll be back next Monday. So, Bobby, appreciate you.
All right, Brad. Thank you.
See y'all next time.